Again, that message, just 18 seconds in length, was recorded at the White House before President Trump was flown to Walter Reed Medical Center tonight. This is day one of his isolation after testing positive for COVID-19.
The president experiencing mild symptoms that includes fatigue and a low-grade fever. We have live team coverage of the president's coronavirus diagnosis. We begin tonight with Haley Hernandez, Houston's only TV health reporter. Haley, a lot of developments just within the past few hours here.
Yeah, exactly. So as you've been pointing out, we know that the president is now being monitored at Walter Reed Army Medical Center. And earlier today, I spoke with doctors here at Baylor College of Medicine. Before that White House announcement ever came out, they were saying that the hospital is the best place for him to get treatment, considering this is a national security threat and a threat to the president's health.
Older adults and those with underlying medical conditions have consistently been warned coronavirus could be potentially dangerous for them. The president falls into these categories, according to Dr. Peter Hotez, and that's reason for concern. Early this morning, Hotez told me that's why the president should go to Walter Reed.
Because of his age and his risk factors, and he is having symptoms, indeed, this is someone you might consider hospitalizing, even if he wasn't a high-profile individual. And the fact that, of course, there are specific national security concerns and there's zero margin for error, and I don't know what kind of monitoring capacity they have in the White House. I would have a very low threshold for admitting him to Walter Reed National Medical Center.
The White House says the president is in good spirits. So how did he get here? Signs point to senior aide Hope Hicks, who traveled with the president several times this week and tested positive just hours prior to him. But that's not conclusive evidence.
I don't think we can say that with confidence. We have to really look and let the contact tracers with the U.S. Public Health Service do their job.
Which means it's difficult at this time to determine who else might have been exposed while he was pre-symptomatic. The White House says First Lady Melania Trump is also experiencing symptoms, a cough and headache.
But it is unclear at this time if the First Lady is going to be joining the president at the hospital. Chris and Dominique?
Haley, let's talk about the incubation period. How long might the first family have had the virus before he felt the symptoms?
So the World Health Organization says that a patient typically feels symptoms about 5 days after an exposure. Now, sometimes it can be as long as 14 days. Dominique, so that's why sometimes when we're talking about somebody going into quarantine after they know they've had an exposure, we talk about 2 weeks, because we know that it could be anywhere from 2 days really to 14 days total, but typically 5 days.
Haley, what about former Vice President Joe Biden? He and the president, they kept their distance, and Biden tested negative this morning, we should point out. But is it safe to say that he's in the clear tonight?
Yeah, you know, I talked to a different infectious disease expert here at Baylor earlier today, Dr. Atmar. He said that we really don't even know if President Trump had the virus during the debate. So we really can't make any determination from that. However, you're right. They were taking all of the right precautions. So he says the risk would be very low.
Okay, Haley Hernandez, thank you very much tonight.